These women are taking pleasure in each other's company, making handicraft and mingling with each other. They enjoy and appreciate their lives. They seem like normal healthy people, but in fact, these women are all cancer survivors.
Everybody has cancer, but whether the cancer cells spreads or not, that is different.
Cancer is one of the most common diseases in Malaysia, yet many people are fearful of the C word. But for these cancer survivors, there is actually no need for such fear at all. For them, knowing that they are not alone in the journey to battle the disease, make them stronger and bolder to face what lies ahead.
Why should I be a slave of cancer? We should fight it. So, I joined the National Cancer Society after 2 years that I had my cancer. I've done my chemo and everything. Then I met a lot of people who has cancer and they are still okay.
I'm very happy coming here also. My husband also don't, but every time he go morning, come back in the evening, say I'm going NCSM. Okay, you go, you join with your friends. I go with them makan. I'm very happy now.
After I come here NCSM, and I see so many people had cancer, and I want to give back something to society. I want to help and try to tell them what it's all about, because a lot of people doesn't know what it is.
These ladies find comfort in National Cancer Society of Malaysia, NCSM. It's a charitable organization that provides holistic cancer treatment and support to patients and caregivers.
The National Cancer Society is the oldest cancer organization in Malaysia. We formed in 1967. When it started off, it was basically more on cancer education. People called us to give talks, and it was all conducted by the doctor. But since the 80s, the society felt there was a need to extend its services, because that's when I think there was more cancer incidences all over the world. So we are proud to say that we are the first to have a mammography center. We brought in the first mammography machine into the country in 1985. And that center is now called the Women's Cancer Detection Clinic.
The Women's Cancer Detection Center is a one-stop cancer screening facility for women of all ages. Their services include digital mammography, ultrasound, pap smear, and bone density tests for early detection.
We advise patients or ladies to come and do their digital mammogram screening as early as 35 years old, because this machine, mammogram, what it does is that you have to lay down your breast tissue under this machine, okay, where we will compress it, and then you will see the images on an X-ray film. It will detect as early as 2 years pre-cancerous cells.
Next to the Women's Cancer Detection Center is the Nuclear Medicine Center. Contrary to general myth that nuclear radioactive is harmful to humans' body, consultant radiologist of NCSM, Dr. Sulaiman Tamanan says it's very safe.
In this center, we are using a small amount of radioactive. We inject the radioactive into the patient, and then only we scan. Okay? So the amount of radioactive we use is very small, and radioactive that we use is also a very short half-life. I mean, if we give, let's say today is now is a 30 unit, after 6 hours, the 30 unit become 15, and subsequently 15 become 7.5. So there's a very small amount of radiation, and the radiation burden to the patient is very, very minimal. So it's very safe.
He says nuclear medicine imaging can also be used to monitor the patient's condition before and after treatment.
And we can also use to look at progress of the cancer. Sometimes people with bone spread to the bone, they have undergone treatment, and we want to find out whether the treatment is effective or not. So we repeat the scan. Then we can compare the previous scan and the latest scan to see any difference, any changes in the spread of the bone, or any new that has been, any new lesion that has that makes the disease progress.
NCSM also shows their care and support to young patients by setting up a home away from home, known as Children's Home of Hope.
This is the Children's Home of Hope, where the children are recommended by pediatrician from Hospital Kanak to stay in this home. All up and about patients, they are not too ill to remain in the ward, so that they can just go for their daily treatment. And then After their treatment, they come back to the home where the mothers are to take care and to cook for them. There are 2 special rooms for bone marrow transplant. There is room 6 and 7 where we have got bathroom attached because their resistance and immunity is very low. So isolation is very important for them and cleanliness.
So it seems these cancer survivors at the center are living proof that life is precious and that every life is worth fighting for.
We need to prove to people, that after cancer, just, eat well and be active, so that you don't always think of, I have something, and whether, it's going to happen to me one day. So when you're active, your mind is active, you'll be very positive.
Life never changed much, It's the same actually, it's not a big deal. It's just after treatment and you're back to a normal person again, full of positivity.